There's no doubt that the frequency of people coming in with liver-related harms is increasing year on year.
Where we're seeing most of the problems within the health service now is not with people presenting for treatment. It's in people who are required to go into a general hospital or are going to see their GP. But the problem underlying that is their alcohol consumption or their alcohol dependence.
They may end up in a breast cancer ward or, in a GP practice seeking medication for low-level depression or anxiety. And I think part of that challenge is that those people don't often necessarily associate alcohol with the harm that they're experiencing.
Most people don't know they have liver disease until they have a severe catastrophic complication. About 70% of people in hospital haven't had a previous incident event or a diagnosis of liver disease. Of those, a quarter will die within a matter of months.
It's abnormal to not drink still. It's still abnormal to not drink. It's still not seen as an addictive, dangerous substance. And it's very easy to hide your addiction.
The information, the education only works if you get the regulation right as well. It's no good telling people you need to drink less alcohol will mean less risk to your health, and then them walking around the corner and seeing 20 adverts for alcohol products.
I think there's also a massive stigma with it as well, which prevents people from being able to acknowledge and admit that there is something that's wrong, or that, and I think that again, that's a narrative, I think, that's been developed by the alcohol industry, that it's about irresponsible drinkers. So therefore, if you can't manage this addictive product, then you are somehow irresponsible.
We know that if you reduce the hours and days of sale, you reduce the harm in the environment.
Tobacco policy is protected by the Framework Convention for Tobacco Control. You need something like that for alcohol.
Of course, don't always persuade policymakers, but at least they need to know what they ought to be doing, even if they're not doing it. So I don't think there's an argument for diverting for that message.
Certainly in recent years, as the government finances have been constrained, we've seen the alcohol industry really making that case that if you try and reduce alcohol consumption, effectively you're reducing government tax revenue.
Yeah. The solutions, I sort of think we've got a lot of evidence around that. The big one now is political will.